Great. Well, thank you, Gil, and thank you, everyone, for joining us today. I'm excited to have this esteemed panel here from really cross-industry, different sectors, different perspectives. And what I'd like to start with is hearing from the panelists really what they believe are areas in healthcare that are ripe for disruption from digital healthcare solutions. So as we look at this broad, expansive healthcare delivery system, varies greatly around the globe, but by and large there have been lots of challenges facing the growing populations, the aging populations, the lack of supply to handle the growing demands we heard about in the plenary session. So I'd like to hear from each of you what you believe are really some of the key areas that are ripe for disruption from digital healthcare. And Marco, since you got the mic, why don't we start with you and we'll work back to David.
So I think I would like to start by saying something very unscientific, untechnological, and I would just like to say something that relates quite closely to the iron triangle I discussed in the plenary before, which is that we do need something, someone, some firm to help us drive down the cost of care by a factor of 1 million. I'd really like to see marginal delivery costs go to zero. Doesn't mean pricing has to go to zero, but I think we need that as a kind of a thematic objective of innovation in digital health. And I think the other one is we just need folks to understand about access to care. We do need to democratize healthcare. And you know, I come from a country in which there's 2,200 very, very highly skilled hospitals serving an eastern seaboard, and then there's a large hinterland of hundreds of millions of folks who need to travel to high quality healthcare. Marco, we can't hear you. I'm sorry. Hold it closer. Okay, good. So one of the political and one of the societal and moral imperatives that we have in Ping An is to help China allow many hundreds of millions of citizens who today need to travel great distances to seek quality care, achieve this care in the comfort of their home or in a clinic, a decentralized hub and spoke clinic closer to where they live. So, you know, understanding both the cost imperative and the access imperative, I think, are the starting blocks of a successful innovation in healthcare, way before technology, way before anything else.
Ryan?
Thanks, Alan. Great to be here. I think, you know, what is a stark realization for me, particularly having spent the last couple of days with you, is that the spend on the defense budget and the spend on the health budget is roughly the same. And in fact, health spend has just exceeded defense spend. Yet healthcare lags so far behind in terms of disruption, innovation, and adoption of new digital mechanisms. And that's a difficult question to answer. One wants to understand why. Probably got lots to do with the emotion, fragmentation, complexity of the stakeholders, and a physician-led system. And so your question is, where is disruption going to happen? And my answer to you very crisply is around patient centricity. I think we all work in a system that is very provider-centric at the moment. And if we're able to put the patient at the center of the healthcare system, empower the patient with the right information through sensing, measurement, and other tools, and enable the patient to manage their own destiny in the healthcare system, I think that will be the biggest disruption. That, of course, requires a convergence of data on the one side, and using that data to give patients relevant messages at the right time. And on the downstream side, or the supply side, it requires that the providers work in teams in more of a competitive market, where patients can be discerning about how they access provider assistance. That, for me, I think, is the largest disruption. Hopefully, if we do that, we can convince people to change behavior, stay healthier, require less health care and focus more on wellness. And for the chronically ill, who are the biggest burden in terms of cost on the healthcare system, hopefully guide them down pathways that minimizes their risk and maximizes outcomes and cost efficiency.
Laudable goals. So Valerio, tell us your disruption.
Well, let me share something with the audience. It's very, very good not to have that ticking clock of 3 minutes to talk about a very complex subject like the one we are addressing, because I think all of us went through that stressful moment of delivering a message in a very short period of time. As I said before, when you think about companies like ours, where we say that at the forefront of our strategy you have the connection between health, nutrition, and wellness. It's very clear that we have to observe what's happening in this whole industry of healthcare with a very good curiosity and also looking to the elements that could open up when you combine the elements of what we eat, what we are, and how we live. I think you're all familiar with the fact that the non-communicable diseases around the world are going up very, very quickly and higher, and a major responsible of some of the high cost on the healthcare. And depending on countries, depending on geography, between 60 to 70% is related to lifestyle. And lifestyle is related to what we do, the activity, how we sleep, the stress levels we have, but there's a fundamental part which is also related to what we eat. Because we are what we eat, as I said before. So in order for the people to realize that what they eat has a consequence on their life, you need to be able to overcome a big problem, to know more or less, as a sort of a shopping list, what you are putting in your body. We talk about autonomous cars, but those autonomous cars have input and output, and we're measuring input and output. And unfortunately, we are measuring all the output, in our case, with our disease, with our heart rate, with our blood pressure, cholesterol levels, but we're not measuring what we put in. Or if we are not measuring, we have an indication, and we start to be concerned only when we start manifestation of trouble. If your cholesterol goes up, that's why you start going and Googling and see what are the foods which allow me to have my lower cholesterol. And maybe in all of them you like it. If you're able, and I think the new generation is much more prepared to do that, to start tracking and knowing how much nutrients, macro, micronutrients, which are important for you as an individual, that you absorb in your bloodstream, because you can track that very easily. All these new things are opening a new dimension on preventive care, which at the same time, the combination of digital care and what I call digital nutrition, so digitalizing information nutrition to make it very easy for the people to understand what's happening and therefore still make the right choices for their life. I think that's where the problem is. We all think about health, but we also have to think about us as individuals and what we do and how we bring that type of well-being inside.
Thank you. Building upon my colleagues, I'm going to actually ask the audience two questions. And I think if Alan's question of where disruption will come, it'll be that everybody will be answering these questions. So raise your hands. My first question is, who here in the audience has a great doctor? Raise your hand. Can anybody tell me how they know? How do you know? Okay. Well, the people that have a great doctor, if you ask, usually why? Why do you have a great doctor? Because he has a holistic view. Do you know how many people he's misdiagnosed in the last year? No, I think that's one of the issues is when you go to get your house painted, you'll ask, who else houses have you painted? Did they do a good job? If you want to buy a car, you go to Consumer Reports or something and you say, is it a good car? But generally, physician, you say, yes, she's a great doctor. How do you know? I like her. She calls me back. Fundamental issue. Dates back to what I said in my talk, that humans are a limiting factor. Doctors play a critical role, so I'm not downplaying it, but that's it. My other question I'll ask you, if you've been treated for a disease in the last 5 years, were you treated in the best way for your biology? Nobody can answer that question. So when people say, what is the biggest disruption in technology that anything could bring is two questions we'll be able to answer. That I'm being treated with the best treatment path, not only that has been validated with the global community, but tailored to my biology. And if I ask you, do you have a good doctor? Probably you'll be able to say, I don't really know because I don't see a human that often because most of the stuff is automated. Because in the future, doctors play a critical role, but a lot of it will be only for the hands-on stuff where you need somebody to touch you. But most of the, hopefully, diseases that we prevent will be handled automatically, using global knowledge applied locally to a person.
Thank you, David. Can people hear? I'm not sure this. No. All right, I'll use this mic. So these are some big ideas. Access, cost control, patient centricity, personalized medicine, information at the right time, giving you the right answers. So now I'm going to turn the tables and ask each of the companies, Siemens, Nestle, Discovery, what they are doing in digital health, and does it link to some of these disruptive areas? Any of them. It doesn't have to be the ones you personally mentioned, but are there initiatives, are there activities geared towards addressing some of these big problems that I dare say if we had a panel of other experts in the field, we would have some overlap with some of the topics that got raised? I'll start with you, David.
So at Siemens Healthineers, we are the world's largest supplier of smart infrastructure when it comes to imaging diagnostics, lab diagnostics, guiding therapy. And a lot of our focus is along these disease chains. So it is when you talk about a disease progression, anything cardiology or oncology, starting from screening, maybe you're doing a CT, a quick CT to scan for lung cancer, all the way to, God forbid, you have lung cancer, using their solid tumor or liquid biopsy to guide your therapy. And really having solutions that are integrated along that disease chain, yes, to also do the prevention and diagnosis, but also to guide therapy. And over 70, probably close to 90% of clinical decisions are guided by technology we bring, and we've got to help integrate those solutions. So they're not point solutions that are ordered by a doctor, but they're integrated solutions that dictate an optimized care pathway.
Well, we're trying to digitalize all the nutrition science that we've developed over these last 20 years. There's a lot of knowledge between what are the needs that a human being has, depending on the genotype, but particularly depending on also the race, that some people need more or less of macro micronutrients. We have basically 4 institutes in Switzerland, and 2 of them, one is the Institute of Nutrition and the other one is the Institute of Health Science. And these 2 institutes work hands in hands in trying to work, obviously, in tracking what people are eating and what goes into the bloodstream, what goes into other parts, right, and what gets absorbed, and what are the needs. And we know that individuals, there are tables, there are medical tables and other type of tables that need a certain minimum level of macronutrients in order that metabolic performance individual is at its best. So we're not looking only at people with disease, but we're looking at normally the medium of how you can perform as an individual. Digitalizing all that information and making it easy accessible through interaction with food and being able to decompose the food into macro micronutrients and give you an overall scoring mechanism at the end of the day, which then you can decide what you want to do in a normal state is what we're doing. And at the same time, we're pairing with technological companies which are working on sensing and sensor technology, which are able to track what we call, and it was mentioned on my slide, the voice of the body, because we all have a voice. Now you have a voice. Your body is silent, but sensors can perceive that voice, and that voice can easily be translated into input and output. And nutrition can have a big impact on your sleep, into your mood, into other type of elements, independently from other things. So while we do that, we're trying obviously to get the feedback, so the big data that comes back, in order we can recustomize product with ingredients that people are missing in certain parts of the world. So while we talk about the Western world, we're talking about the Western world. In the Eastern world, there's a lot of people which have malnutrition, which are very short of macro micronutrients. And being able to fortify those type of products, you do a big service for iron deficiency or zinc or other type of issues in the developing world, be it Africa, be it in China, for example, they have big issues of vitamin B, et cetera, et cetera. So I think that's the type of work we're doing, collaborating with technological companies, and at the same time trying to digitalize that information in order we can bring it to the people in different type of forms.
Thanks, Alan. So the question is, what are we doing to disrupt? And the starting point for us is what we're about. We're about enhancing and protecting people's lives. We've recognized that the nature of insurance is actually about protecting ourselves and our customers against behavioral risk. If you can mitigate behavioral risk and you can get people to do the right things, then you create a shared value system where those people are healthier, live longer, The insurance company is obviously much more solvent with much lower claims, and society benefits from a much more productive environment. So that is really what it's about. How do we do that? We embraced digital technology to do it. So we create a program that provides digital points, vitality points we call them, to our customers depending on what they eat. So if they eat healthy Nestle food, we reward them for that. If they eat chocolates and sweets, we certainly don't.
It boosts your mood.
Based on how they exercise, we give them a free wearable device, like the Apple Watch I'm wearing is one example. We give it to you for free. We only make you pay if you don't exercise enough. You get a points target that you have to meet every week. If you don't meet the points target for the week, you pay a little bit that month. If you meet the points target for the week, it's absolutely for free. And so we've got thousands of people all over the world, in China with Ping On, in the UK, in the US, and South Africa, running like hamsters to meet their points targets using wearable devices. And it's one of the few examples in the world where wearables have got a direct commercial implication to the financial well-being and, of course, in our interest, to the wellness of those customers. So that's one example of how we're digitizing stuff. The second, a very quick example, is taking data, putting it together with the clinical information that we have about the demographics and the clinical information and the lifestyle of our customers, and using it to make predictive models so that we can enhance and protect their lives. So I'll give you an example of something I saw 2 weeks ago, just fantastic. Our actuarial team has taken our whole population of cancer patients at Discovery and has applied regression models and some GLMs to understand who is likely to develop depression and at what stage of their cancer journey. And we can now predict with a 75% accuracy, which isn't bad, exactly when you're going to become depressed in your cancer journey. And we use that predictive information now to reach out to those cancer patients and try and stimulate them to look after their mental health at the appropriate course of their disease. And I'm sure all the clinicians here realize that mental health and your mental well-being is very important for your somatic recovery. And one last example, we're working with a digital company out of Silicon Valley to provide an AI interface to our customers so that they can ask any healthcare consumer-related question and get a meaningful answer. And that's about patient centricity. It's about informing the patient early in their disease symptoms to try and do the right things and make the right decisions. So 3 examples.
Great. Marco, I'm going to throw another question over to you. We heard from these companies about some of their great disruptive digital health innovation and some exciting programs and initiatives. Started to hear a common theme. We heard about Apple Watch, Silicon Valley, some of the other initiatives, and many of you are aware, I'm going to rattle off some scary names to healthcare providers. Amazon, Apple, Facebook, Google, Microsoft, companies that are consumer-oriented, talking about putting the consumer front and center. We're also, many of you may have heard and seen, Amazon, Berkshire Hathaway, JP Morgan forming an alliance to deliver healthcare insurance first and foremost to their employees, but with a goal of removing profit and ultimately disseminating those capabilities broadly. So first I asked you, Marco, as an investor, how does that consumer-oriented, big companies coming into healthcare, how does that impact your investment, and how does that change what you view as disruption?
That's a great question, Al. I'm grateful for it. And so I think no one company, whether it's Ping An or Siemens or Nestle or anyone, can really have a commanding stake in digital health. So we welcome the interests of the FANGs of the world. We welcome their skills. We, in fact, regularly hire people from those e-commerce and digital health giants into our own company where we have 22,000 developers. So we welcome that investment, that interest. And I think if I would make a small point is that there is something to be said for the big technological giants, but there's also something about them which makes me feel that sometimes they're slower to the market than they should be. And I'll give you an example. So in December 2016, Google publishes in JAMA a very great paper on diabetic retinopathy diagnosed with AI. to such a degree of accuracy that an ophthalmologist is essentially beaten. Now, it's been more than 16 months since that paper. About 3 months ago, there was a working paper that said Google's team had also explored the identification of other systemic diseases in the back of the eye, so hypertension, hypercholesterolemia. But again, it's been months since that paper. What we feel is that there is a huge market for nimble startups to run between the tread of these giants and often get to the finish line first. And we're currently talking globally with a number of startups in the retinal imaging space. It turns out to be a relatively simple problem, I'm told, by data scientists, the segmentation of eye diseases. It's apparently trivially easy compared to the work that Elad was talking about at Zebra. And so there are opportunities for fast-moving innovators to seize the high ground, to get to market, to partner with consumers of such services as us before Google perfects their technology and gets to market. And even if they get to market, you can bet that it will be the US and Europe that they get to market first, a long time before, if ever, they get to China or other parts of the developing world. So we welcome them. We're not afraid of them. We think net positive and not a threat, I think, to the startups that we see around us.
Thanks. Very, very interesting perspective. Valerio, I'm going to want to hear from you. You're closest as a more consumer-facing company than some of the others up here. What's the scuttlebutt within Nestle? How does Nestle look at some of those large players in healthcare, and how does that impact your strategy?
Well, you refer to the Amazon and those guys. I mean, well, first of all, we sell them products that then they sell, right? So we know them very intimately, and we buy a lot of their service because we do a lot of marketing in some of those big platforms. So there's already a relationship going on that area. I believe when it comes to nutrition, there's not a lot of knowledge in those companies, and we have a lot of knowledge along with some of the leading universities. So I think there could be, when the moment is ripe, and I was referring in my last slide that this famous of enablers and support that you need to have in this type of environment, they need to be part of this ecosystem because, well, they have the big bucks to test and experiment and look at things. But besides that, they can work as sort of an integrator into because they already have big platforms that can easily scale up in tremendous way. So I think it's going to be very interesting to see how these ecosystems will develop. The recent announcement is an interesting one to look at. I think there will be an Airbnb in this type of environment. There will be a Spotify. There will be somebody which is able to make people pay, acting as an aggregator of all these different type of services. And I don't think it's going to be a Google or an Amazon, or maybe not even us or any one of us here, but it will be somebody that comes from a total different mindset with a total different aspect and acts as an aggregator where we then can plug and play our different APIs or services that we would need to do that. That's my prediction because we've seen disruption happening in the music industry in this way. We see it in the hotel business in this way. The car industry, if you want, in one way, in the taxi with Uber, and on and on. And I think this is unavoidable. I think we're very close to a tipping point. I think the only message I have for everybody here in the audience, be it startup, venture capitalist, big company, or other thing, you need to be on top of the wave. Because if you just get a bit behind, then you'll never catch up. This is the train leaves the station very quickly. So this is the reason why we are here, which if you think about digital health, we should not be here, right? We think about selling products to all of you guys, but I think you need to be here because you need to understand what's going on. Because the ecosystem is changing dramatically, and that's my biggest point. And I think this is a fantastic initiative that probably puts everybody together to think about how can overcome some of the problems I just explained.
Thanks, Valerio. So I'll throw it to David now. And David, I'd like to hear some of your thoughts about how do you build an ecosystem? How do you make it work? How do startups plug into that? How does financing play a role? And then how do you work with other corporates? How do you make sure, because what we've heard is there are lots of pieces to connect here, and you really can't do this on your own. So tell me a little bit about how this all gets built and then gets functional?
Sure, we could spend a few hours, but I'll break that and maybe I'll tailor it to the audience. How many people here are startups or representing startup companies? So maybe that's the best audience to target it to. So Siemens Healthineers, as I said, we spend over $1 billion a year, or €1 billion a year in R&D, and we partner like crazy. We have over 4,000 partnerships and collaborations around the world. So I can just tell you, when looking to engage a company like Siemens Healthineers, how to, because that's probably the biggest question. The last thing you want from us is our money, because it's probably the least valuable thing. You can get money easier and cheaper probably from people that I'm sitting on the stage from. The biggest thing we could bring is plugging you into our ecosystem, plugging you into our global knowledge. So what I ask from companies when we're looking to collaborate is know a little bit about us and what we do, and understand our vision of where we're going as a company, and then let's discuss on how can you accentuate what we're doing today or add a whole nother area that we're not thinking of, right? We understand you're a small, agile, innovative company, but also respect that we didn't get to be a market leader in a 15 billion plus euro a year company by sitting and milking our products, right? So it's not our innovation versus your innovation. It's not our abilities versus your abilities. It's our abilities and your abilities. Use us. And then be very open. Most companies that we've partnered or invested in, we've known each other for 2 or 3 or 4 years. So it's not that you come in, you make a presentation, you excite us, and next day we write a check for X number of million. That doesn't never really happen. What you do is you work together, you build ideas, you pick my brain and people's brain. I say, have you thought about this? And you go back, and we go back and forth, and we form a relationship, we do some pilots, and then investment naturally comes, or M&A naturally comes. And I think that's the number one thing. It'll always be built around a pressing customer or market need. I do not like technology looking for a solution or looking for a customer need. I like, here's a pressing customer need. Maybe we don't know exactly how we're going to do it, but we think we have a few ideas. Let's work together on it. Start from the market need, a customer need, maybe not even an identified need, but please don't start with some cool technology that's looking for a problem. That's just not one of our markets. I don't know if that answers enough questions, but I also don't want to hog. But
No, that's very helpful and I think insightful for entrepreneurs, especially as you have a new, unproven technology. It's really, think of the customer. Think of how this is going to be adopted, and I think that advice
and communicate like crazy. I'll take a call from anybody and talk, right? And my knowledge and able to scale is probably the most valuable thing. As I said, dollars or shekels or euros you can get cheaper from a lot of places around the world. The biggest thing we could bring is all the billions we've spent on making mistakes and preventing you from making them.
So Ryan, let me ask you, you've established this program called Vitality that's been licensed around the globe. You deal with very different and diverse populations, and there are loads of needs to bring to those populations. How do you assess what your priorities are, and then how do you make decisions about what to bring in to those programs?
It's an interesting question. You know, the starting point is actually not healthcare. The starting point is our life insurance business. We were able to repeat our life insurance model quite easily. You can pick up this financial model of life insurance, put it in a new country, and it just works. The thing about healthcare that's so different to that is healthcare is very locally contextual. It's determined by the relationship between the demand side and the supply side, with very different regulatory environments in each jurisdiction that you tend to enter. And so linked to that realization that healthcare is so contextual, we recognize that you need really smart local partners. And so we don't pretend to be able to identify what the needs are in that market or how our model will tap into, say, a rewards infrastructure from an incentive point of view. We rather partner with the leader in that local market to do it. In China, for example, we partner with Ping An, who is the leader in that market. And so in Ping An Healthcare, which is the health insurance business in Ping An. We're a shareholder, minority shareholder, contributing the Vitality IP and knowledge and some health insurance knowledge, working closely with a local partner in the market who does understand the needs, who has a feel for the demand and supply side, who has a good understanding for which reward partners will incentivize people to really change behavior. And we've done the same around the world. So that's our partnership model.
Very helpful. So now I'm going to change the format a little bit. We're going to go for some rapid fire, quick answers on a few topics. And Marco, we'll start with you and work all the way down. Just a few sentences. First thing is, when we look at our healthcare systems globally, what's going to be extinct or near extinct in the next 5 to 10 years? What about healthcare today won't be anything near what it is?
Solo practitioners, physicians trying to make a living by themselves, behind the curve, poorly maintaining continuing medical education, poorly linked with specialists, hospitals, other providers, and ancillary care providers. The time for people like me 30 years ago who was a solo practitioner is dead, should be dead, and will be dead.
Yeah, I would have given the same answer, but linked to that, I would say paper. It's just incredible how outside of Israel, the healthcare systems are just filled with paper. Yet industry has progressed way beyond that. And so I think paper is disappearing. Everything is going to be digitized and captured in electronic format. And analytics will drive the insights as opposed to anecdotes.
The fact that you are going to have a patient that's very well informed about himself or herself by the time he walks in, already has made a mind of what type of disease and what type of elements he's going to have, because he's going to have this mirror of this image telling him what's not going well. And therefore, the doctor and the practitioner skill needs to be really networked into a big network in order he can have these answers very, very quickly. Therefore, I would say the whole digitalization of information is a must, and that will create the obsolescence of the current system.
Agree with all of you, and I think the other thing would be going to a doctor's office for anything other than when a doctor has to touch you.
So telemedicine.
Whatever the mechanism is.
Okay. All right, now, of the existing areas of digital health, we're going to go back the other way. AI, big data, genomics, cybersecurity in healthcare, we can go on and on. Tell me what you think the top 2 or 3 winners are going to be in that same 5 to 10 year period. Are there things that you look at and say, wow, it's in its infancy today, or it's starting to gain traction, but in 5 to 10 years today, this is the winner? AI for diagnoses.
So I think, as I said in my plenary talk, those will all be enablers to something where I think is the biggest unmet clinical need, is how do you apply global best practices to an individual patient? How do you collect what is the best care pathway for a disease or for prevention and apply it to that local person's biology? And make that person the 1,000,000th and one in that chain in real time. Just like Waze does it for traffic.
Well, the fact that the people will have in their hands their metabolomics, their genomics, will allow them to make the right decisions in terms of lifestyle and what they do is going to be the major change. AI will be a layer on top of it, which will allow very, very quickly to create out of this huge amount of data that each individual will create a sense to us, like we looked ourselves in the mirror in the morning, right? I bet you all do that. And you know if you had a bad day or a good day. And there will be devices which will tell you that, and that will basically will be enabled by technology and AI.
2 quick answers. Sensing, a combination of wearables, what we do, what we eat, and omics, who we are and what we're made of. So sensing on the one hand, and I think that's where lots of the money is going at the moment. And then on the other hand is deriving the insights from the sensing and actioning those insights. So that's big data analytics and perhaps AI on top of the big data analytics to action the insights. And that for us is the future.
Clearly, I agree with all my colleagues on the panel. I would just add there's a paradigm thing here. We're going to move from episodic, punctuated diagnoses and therapies to continuous monitoring, continuous delivery of solutions, whether it's a patch for drugs, whether it's a therapeutic AI intervention delivered by an AI engine. So I think this change from punctuated to continuous is one important thing. The other thing I would say is that change is always happening. We cannot be sure yet. I don't think out of that list that you gave, Alan, that's the sort of information set that we're dealing with. We are going to be surprised by new technologies. What we learned from BrainQ yesterday, feedback loops to make nerves regrow, was for me science fiction until about 22 hours ago. So keeping an open mind and being ready to adopt change when we see it will be a critical change the next few years.
Great. So now we're going to go back again. Quick answer. We have a very talented audience in Israeli digital health ecosystem. If I could have an entrepreneur develop anything, it would be...
This is where I regret holding the mic at that point. I think it would be not the technology, not the use case, to Alan's point, not even the business model, but a validation, a real statistical validation. So if I put aside the medical stuff and put on my applied statistician hat, when claims are made, I would like that startup to have an appreciation for the reliability of that claim. Not the hopefulness and the passion with which they believe that, but the convincing statistical proof in a long-term trial. That is missing. I see that as an absence which stymies our ability to deal with the innovation. So that's kind of a negative point. Hopefully people take that as a constructive feedback.
It would be a personal pathway for every one of our members that optimizes their wellness and health outcomes in the long term. Personal pathway. That would be it. I would have a second request. If they could help me with some of my parenting and some of my difficult children, that would be wonderful too.
I said it before, how can we capture information in an easy way? And in this case, obviously, as I'm preaching about nutrition, how we can capture nutrition in a seamless way, in a passive way, in order that it's not too much intrusive if I'm eating a banana or I'm eating a kanji soup in front of you, but it will capture it in an easy way. And the databases, because today, believe it or not, the only correct database we have in the world is the USD database when it comes to nutrition. And the rest of the world, I know few places are doing it, but that's not there. So databases are very critical, because without the database you cannot put AI, you cannot do anything. So really, really important.
Mine will be more of an applied digital. I think it's important. We talked a lot about genomics. So develop something where they have the ability to do a full genome in minutes and for dollars. And that will revolutionize a lot of stuff we're talking about here.
So all you entrepreneurs and investors, you've heard what the secret sauce is. These are things that, if developed in that period of time, you have ready, willing, and able partners and companies to help commercialize these things. We have a few minutes left. We're going to open it up to the audience. If there are any questions, I'm not sure if there are mics out there. If not, why don't you come forward and we'll give one of the mics to you. Please come up towards the stage and we'll take questions.
Hi, I've got two questions. Firstly, Ryan, you said that the whole medical fraternity is, you'd like to get rid of paper. So if the medical world is so paper-based today, how are you going to get all this big data information that you need to globalize your delivery of medicine? And on a personal note, I'm a dentist. And is there anything specific that anyone could say about dentistry? Thank you.
You've got good teeth. I don't know the answer to getting rid of paper. We're sitting in Israel. Israel was the first to go to market with an electronic health record 17 years ago, way ahead of everybody else's efforts, and today has 98% penetration with the central database. So actually, perhaps the answer is right here in the country that we're sitting in. because every other market that I've been to, without exception, maybe Estonia is one which also has a complete database, but every other market has failed. And it has been about the behavior change of the doctors, not the members, to get the doctors to capture efficiently. I visited Cleveland Clinic recently. They're a partner of ours on some care pathways, and each lead physician at Cleveland Clinic has a physician assistant who's otherwise known as a scribe, who walks around behind the physician and captures everything that the physician is doing, because they couldn't get the physicians to capture it. Now, that's not the answer, right? So it's one of the best places to get care in the world, and no disrespect to Cleveland, but we can't afford that in our environment at all. So I don't know the answer to paper, but we're thinking very hard about that. And I think, as you know, being a South African, picking up your accent, we're paying doctors to stop using paper in our market. We're incentivizing them financially to say, do things digitally, here's a meaningful use incentive, change your behavior, and we'll make it worth your while. We'll pay you for that extra time. But we haven't succeeded yet. Oral health is greatly, and the importance of oral health is enormously underestimated. And as clinicians, we all know that it's often the nidus and the start of an infection that materially impacts you systemically in other parts of your body down the line. Doesn't get the kind of attention we need to. I think I'm certainly guilty of that as a leader of a healthcare enterprise. And it's good that you raised it. We should spend more time talking about it.
So I'll discuss the dental side because I think it's an important thing. You're not just a dentist. There's a huge amount of the population in the world that only goes to see people when it hurts. So you actually are a great preventer of future dental issues. And I'll ask you a question. Do you screen hemoglobin A1C in your practice? Because, you don't, but I think it's a very practical thing. You probably know from changes, you can see if somebody might possibly be a diabetic. And they probably have only come to you because it hurts. And I think that's where we have to think broad of not in our areas of I'm a dentist, or I'm a primary care physician, or I treat cardiology, and say, if a patient's coming to me, how do I look at them holistically, and how do I maybe the only medical practitioner they'll see in the next 10 years, and how do I use this as an opportunity to prevent future healthcare issues?
I'll just add one thing on the paper. My partner in Qure, Dr. Yossi Bahagon, he led the efforts at Clalit, the largest HMO here in Israel, to transform from a paper-based system to a completely digital health environment. So I'm sure Yossi has a lot of tips on what worked, what didn't, and how to implement that on a wide scale.
Can I just build on David's point, which is you're in the patient's mouth, you're close to the throat, throw some UV light in there after you've put in a stain, and check for oral HPV infection precursor. Males of our age, unfortunately, cancer of that part of the throat is really prevalent. So that would be my immediate feedback.
So we have time for one last question, and then...
One of the big obstacles to getting personalized medical information is things like HIPAA in America, or things like in Europe or in the rest of the world. How can one access the big data to be able to do analytics as long as things like HIPAA exist?
So I'll answer quickly from my experience in building a company in the States that worked with hospitals and medical groups that were treating over 80 million Americans. We had provider opt-in. Essentially, we were designated business associates of every provider we worked in, so we could create a database that would allow that. That data didn't go to the patient. It was used by the health system to more actively manage, but we had that big data asset to perform analytics, predictive models, et cetera. I think technologies like blockchain and other initiatives where patients are consenting for the use of their data for particular things are going to be big drivers in the next generation and over the next 10 years to really freeing up some of those data sources. So with that, I'm afraid...
Can I comment quickly on that?
If you want to hear the comment, you can stay after offline, but thank you everyone, and thank you to the panel for all your comments.